Hey guys, welcome back to Baby Bump Life. Nurse Wit here again, and want to talk to you guys all about pain relief options during labor and delivery. And I want to make sure that you guys are educated on your options, just because too often I do see mamas in the hospital who maybe they haven't been given all of the information about the medications, and they're changing their mind kind of at the last minute. And so I just want to make sure that I'm putting out as much education out there for you guys as I can, so that you are aware. So, of course, as you all know, you can go natural. I do personally believe there are certain types of people who can do that better than others. There are the ones that I have seen during delivery where the moms are just very silent as they're kind of pushing, and very meditated in that fact. And then there's some who have kind of lost the control and kind of let themselves go and are screaming through the natural delivery. So it's all about mind over matter when it comes to natural deliveries. So I will talk about that later in another podcast, because I do think natural deliveries are awesome. I unfortunately didn't get to try to experience that, or to see if I wanted to experience that. Again, as you know, if you've listened to my other podcast or seen my YouTube channel, I did have to have a C-section because Hugo was a big guy. So, but anyways, there are a lot of options for meditation and distraction and relaxation when it comes to natural deliveries. So like I said, I will go over that later. But as far as the pain relief options, when you get to the hospital, if you're finding that you need something, here are some of the most common things that you can do. So to start off with, a lot of the doctors will write an order for pain medications first. Now, what you should keep in mind with those pain medications are they do go through your IV typically. Some doctors will order for an IM injection, so a shot, but typically they do go through an IV. And these medications do cross over to the placenta barrier, so that means they do cross over to baby. So the way they make you feel is the way they make baby feel. Now, that is fine in early labor, but in later labor, we want babies to not get that medication because they don't have time to wear that off. So this is something that is safe in early labor. They do have a cutoff on when they can give you that medication, usually somewhere around 6 centimeters, something like that. It does depend on your nurse and doctor and hospital, I guess. But some of the medications they give, Stadol, Dilaudid, fentanyl, they are all shorter acting medications. So they're not going to give you the pain medicine through your IV and it's going to last the whole time. It may only last an hour for you and you need something else, and you may be able to get some more of the pain medication, or you may not be quite due for it at that time. Depends on the medication they give, and it depends on how long they order it for, or how frequently. So that kind of leads me back to the whole natural situation, where I do think that it is really good, even if you don't plan to go natural, to be able to understand the relaxation portion of that and how to control your pain in those beginning stages. Because if you do start to take those pain medications too early, then it kind of doesn't help you later on when you really need it. So if you're taking it and your pain level is on the lower side and you're like, oh, I shouldn't be feeling anything, then you kind of have the wrong idea. You should be expecting to feel a little bit of pain. This is labor. This is how our bodies were made. It is a painful process. So as long as you understand that you will experience that little bit of pain, and as long as you can withhold that pain before taking some medication, in my opinion, from what I've seen, the better off you will be, because you aren't going to run into a period of time where you really need pain medication, but you're not due for it, and you're not dilated enough quite to move to the next step, which would be an epidural. And so you kind of run out of options. So if you can withhold that pain as long as you can, then that kind of helps you get into the most ideal situation. So the other thing is just being in good communication with your nurses, because your nurses typically have to check your cervix first to see how far dilated you are, to determine if they can give you the medication, if they can't give you the medication, or if they can get you the epidural, kind of depending on your plan. So if you are at the stage of being able to get the epidural, which is anywhere from like 3 to 5 centimeters, kind of depending on who your doctor is, or nurse midwife and what their orders are. But if you're in that area, that time frame of being able to get your epidural, then your nurses will get that for you. There's typically a couple things they want you to do. You need to have an IV. You have to have some fluids running and get kind of a bolus of fluids, so a nice big amount of fluids that flush in your body pretty quickly. And then they need to look at your blood levels to determine that it is safe to give you the epidural. So those are the things that kind of have to be done before you can get it. So sometimes moms come into the hospital, they're screaming, I need my epidural, I'm in a bunch of pain. Well, there are a couple things we have to do first before we're able to get that for you. So just kind of keep that in mind when you are thinking about the epidurals. The other thing to keep in mind with them is, say you are there in early labor. Sorry, Mr. Hugo's enjoying himself watching his show. The other thing, though, to kind of keep in mind is typically the anesthesiologists are always at the hospital. There may be some smaller hospitals, depending on where you deliver, that the anesthesiologist may be at home and you may have to wait for them to get to the hospital. But nowadays, most of the time they do hang out there. So usually they're pretty readily available unless there is a C-section and they are busy in the OR with another patient. So just be in good communication again with your nurses to let them know, hey, my pain is kind of getting a little bit out of control. I know I'm 5 centimeters, and I know you said, I told you I'm doing fine with pain now, and I know you said that I shouldn't wait. So is the anesthesiologist available? Should we do it now? Just so that you don't miss your window of time. So just always be in good communication, because your nurses, they know what else is going on the floor. They know other patients for the most part. They should be able to help you and know what's going on. So just make sure you are letting them know at what point you're feeling like you may need something else for pain. Because we can't tell what your pain is. Everybody tolerates pain differently. And that's why, like I said, some people can go natural and they're really good at it. And some people can go natural and they're kind of screaming their heads off. So, but we all are different people. We all tolerate pain differently. So just kind of keep that in mind, that you need to let us know where you stand, because we can't always tell just from looking at you at what your pain level is. And then just to explain what epidurals are a little bit for those of you who don't know, but know that you want the pain relief that you've heard about with epidurals. So epidurals will not wear off. They are medication that goes inside a little teeny tiny tube that goes in your back in your epidural space. And that tube gets connected to a pump typically with medication, a bag of medication. The anesthesiologist will typically set that based on your height and weight, and you'll get a certain amount each hour until it's turned off after you have the baby. Typically it takes a couple hours for it to wear all the way off, and you will get up with your nurse for the first time as you're starting to get the bearing back in your legs. Do not get up and walk with it unless your anesthesiologist has let you know that you're allowed to. But I have not worked at any facility where they are doing epidurals that you are able to walk with. So even if you can move your legs, that doesn't mean that you can stand enough to bear all of your weight. So even if you can move your legs, as long as you're not having pain, the epidural is working. So every anesthesiologist is different. All of our bodies are different. Sometimes moms can move their legs. Sometimes their legs are completely dead. They can't move them. The big thing is, can you feel the pain or not? Because that means it's working. So With the epidural, they do set the pump so that you're able to feel a little bit of the pressure down there. It'll feel like you have to go to the bathroom, very, very bad, number 2. And you'll feel that pressure down there, and you have to feel that to know to push. So sometimes moms, towards the end, as baby gets lower, they're like, I'm having pain again, I'm having pain. I'm like, where? They're like, well, down there. Well, it's good. We need you to feel a little bit down there so that you're able to push. If you're completely numb, then you can't figure out, it's very hard for you to figure out how to push down there. So they do need you to feel a little bit. If your pain starts to come back, you should let your nurse know. She can contact the anesthesiologist and let them know that you're having pain, to give you maybe a little more medication through there. If you do have to end up with a C-section for any reason, they can give you more medication through that line and make it where you're completely numb. So that is another benefit of having the epidural, is if you do have to have a C-section or emergency C-section later on, they're able to give you the medication very quickly through that. When getting the epidural, your nurse will help you get into the position that you need to get into, and the anesthesiologist will be working behind. They'll numb up your back first. It'll feel like a bee sting. They numb it with a couple of shots first. Then when they put in the actual epidural needle, you'll feel more pressure typically back there. Then when they thread the catheter in and they're in the right spot, ooh, no screaming. Sorry. When they are threading the catheter in, then you may feel like a zing, kind of like a funny bone sensation down one leg or the other. It's not considered unnormal if you do or don't feel that. It's just typically you can feel that. And that's just the epidural as it's kind of sliding in. Then the anesthesiologist will tape your back up, keeping that in place. And then it takes typically about 15 or 20 minutes for it to fully kick in. You'll start to feel your contractions that are shorter and shorter until you can see them on the monitor and you're no longer able to feel them. Then it is working for you. So every hospital is a little bit different with their procedures and how they do it. So just make sure you are asking appropriate questions to both the anesthesiologist and to your nurses before you are getting the epidural, if you do have any questions with that. One of the other options, just to kind of talk about, and again, this depends on where you're delivering at, what state, what hospital, but there is nitrous oxide out there, which is like the laughing gas, and that has been given to moms in labor as well. Again, there are certain hospitals that are doing this. I know we were trained on doing this and just starting to do it, and then we had a pandemic, and with COVID-19, it is not recommended to do the nitrous oxide because of how it is administered, how you're breathing it in. And so we're not typically doing that at this time, but that is another option. Maybe as things kind of get better around the country here, we may be starting to do that again. So just kind of keep that in mind, as it is another option that may be available to you later on. So I hope that helps you guys with the different pain options. And if you have any other questions, please feel free to email me, babybumplife@gmail.com, or you can message me on any of my social media accounts that I have as well. And I will be putting out a video here soon for you guys too about natural childbirth, because like I said at the very beginning, I do feel that that is important to educate yourself on as well, especially in the beginning if you're not quite able to have pain medications. So thank you so much for listening, guys, and until next time, I will talk to you all very soon. Thanks. Have a great day. Bye.